Namaste and welcome to part 2 of Psychoanalysis, View of Klein of Process of Internalization. So far in part 1, we discussed with our subject expert Himanshu Vaidyaji why the internalization life of an individual, how it is a default setting of any human life, what facilitates internalization and what opposes it. Moving ahead in the discussion with our subject expert. Namaste, sir.
Namaste.
So we were somewhere in a very interesting phase of the discussion. If internalization has been such a good, reliable, stable object you need and search and then done, hasn't it happened in childhood? Then how it can be healed later in the life?
Simple answer is what has not happened then should happen now. Meaning, if in the childhood you did not experience a safe, good, reliable, stable, loving relationship for a long time, allowing you to internalize it and make it a part of yourself, and to have a good, reliable, stable object as the core inside your mind, right? Adequately internalized and adequately functional. If that has not happened in the childhood, then one thing that can heal you is safe, stable, and reliable relationships in adult life. You would have heard about many people who used to suffer from XYZ problems, but after he got into relationship with X, he got healed. That relationship is healing, and not necessarily it should be a romantic and sexual relationship. It can be any relationship of a friend, of a teacher, of a guide, of a mentor, of a colleague. But any safe relationship, good relationship, stable relationship for a reasonable period of time, that allows you to complete the process of internalizing a good, reliable, stable object, which did not happen in childhood. And therefore, you derive that healing. I have come across many people who used to have autoimmune sicknesses like asthma or skin sicknesses. And after they had a good relationship with somebody, it got healed. Right? And with relation to asthma, I know about it because somebody told me when that girl came to know that I have asthmatic issue. She told me that one good relationship and you will be out of it, because it happened to me that way. She had very severe asthma, but she got into a good relationship with a man, and in 6 months' time, she was off. I'm not saying this is how every asthmatic will move, but this is one case in point. So with the strength of sample of one, the point still is made. So in adult life, if you experience a good, reliable, stable relationship for a long time, a safe relationship, the process is completed and the profits of that process start accruing to you in the area of mental health and physical health. This also happens in case of therapy. That in therapy, if somebody is coming to you twice or thrice a week, and that goes on for long enough, the internalization of a good, reliable, stable object happens. Right? And that is one of the non-verbal components of therapy. That it does not happen by advising, it does not happen by interpretation, it does not happen by any active verbal thing. It happens by its own. And often it is the sum total of assessment of you by the patient. And often the patient tests you to find out if you are really the good, reliable, stable object that you're appearing to him, because he has never had one. So when he has one, he would like to test it out. And there are many tests that patients do, including the test of seduction. So in therapy, many things happen. One of the things that happens is this, the internalization of good, reliable, stable object. That is where the holding therapies are much better on this point, rather than therapies which are challenging or confrontational. Because therapies like ISTDP, which are challenging and confrontational, they are not meant for facilitating internalization of a good, reliable, stable object. They are meant essentially for catharsis.
Catharsis.
But holding therapies of the cohesion type, of the classical psychoanalytic type, they are very well geared for facilitating the internalization of a good, reliable, stable object. And that ISTDP also is slowly coming to realize that in cases where the internalization of a good, reliable, stable object has not happened, and without it, it's difficult to proceed, the fragility continues for a long time. And essentially what they have to do is to take a supportive role, meaning thereby they have to give up the ISTDP stance and take a cohesion stance.
More of a person-centric approach, rather.
Yeah, so they have to move from a stance of confrontation to a stance of holding. So they don't acknowledge it, but they go cohesion in that situation. So that is second part, the therapy part. The third is if somebody has a guru in the adult life, that again facilitates the internalization of a good, reliable, stable object. Same, somebody can go into tantra or idol therapy. Idol therapy is very well suited for this kind of thing. That the good object is with you for a long time and you enter into a conversation, you enter into an engagement, and over a period of time, internalization happens. The repetition of stories, the mythology also can be an aid here. And if nothing works, then the mind can create a psychic person. It may be a real life celebrity. It may be an ideal teacher. It may be a revolutionary from history. But somebody the mind takes up as the good, reliable, stable object in front of it so that it can internalize. And if nothing works, as you say, somebody can hallucinate it, because the need is acute and cannot be met, and therefore the person hallucinates it. So these are the ways in which what has not happened in childhood can happen in adult life.
So how do we bring in concepts of the images or unreal internalization?
So this is also a problem in the process of internalization, that the mind in early life is not essentially a very accurate and precise mind. It is loaded with fantasies. It's loaded with projections. So what the person actually is and how we perceive that person are two different things. And therefore, internally, as Klein says, initially fantasy is far more powerful than realistic thought. And therefore, the fantasy processing of the person creates an image of the person which can be very split-oriented image. The person can be exceedingly good or exceedingly bad, exceedingly lenient or exceedingly harsh. And those kind of images, when they are seen and internalized, they create problems. So this is an example of not good internalization, where the images of the persons loaded with fantasies are internalized, or the images may be created out of fantasy itself. So it is the person plus our fantasy, or largely our fantasy and less of the person. They get internalized, and then the difficulties start. One very common example is internalization of a very harsh parent, leading to superego pathology. That even when the parent is not there physically, you feel the parent is there, and if I do X, the parent will punish me very, very harshly. That is because of a very early life internalization of a very harsh parent. which is now inside of you. And at times, when you go weak, you can also almost feel palpably that the person is around you. Right? This is just 2 steps short of hallucination. So these unreal internalizations, which are largely the work of our fantasy or because of projective identification by the other, that can also happen. Or learning by identifying with the other of his fantasy, that can also happen. But this leads to very unrealistic internalizations of exceedingly good or exceedingly difficult type, and the exceedingly difficult type are exceedingly difficult to deal with, because it becomes very clear in therapy that the person is suffering not from reality but from fantasy, but the fantasy refuses to give up. And we find that at times this secret pleasure because of which the fantasy is not given up. At times there is no secret pleasure, but yet the fantasy is just not given up. The internalization is too strong and the dismantling takes quite some time. So this brings us to this whole idea of undoing an internalization. Like first we talked about what to do if internalization has not happened, how to make it happen. And now we are talking about wrong internalization has happened and how to undo it, how to dismantle it. So that also becomes one feature of therapy.
No wonder individuals have different versions of gods and evils in their heads, the two extremes as the split is open.
Right.
In psychopathology, which areas we see internalization difficulty at work at the roots?
Very clearly in psychosis the most. Secondly, in personality disorders, in anxiety spectrum disorders, in addiction disorders, in identity disorders. You can see it in many other psychopathological conditions also, but in this it's very, very conspicuous. If you look at, sorry, yeah, go on.
No, sir. Please.
I was saying in personality disorders.
Would you specify any personality disorders in specific?
You will see lack of internalization of a good, reliable, stable object in most of the conditions. Very clearly, you can see it in dependence, in paranoid personality disorder. Right? You can see it in histrionic, very, very conspicuously. In fact, if you continue therapy long enough, you can see it in all the personality disorders. But right on the surface, even without going deep, in these three, you can easily see it. In case of anxiety spectrum disorders, you can easily see it. And in fact, one of the confirmatory things would be that when you talk to that person